Okay, so my project was on the Roxanal. And so we're gonna open it up. And here it says the definition, which is a highly concentrated solution of the narcotic analgesic morphine sulfate for oral administration used for the treatment of severe chronic pain. Some side effects are constipation, nausea, vomiting, shallow breathing, headache, dizziness, spinning sensation, anxiety, flushing, memory problems, or sleep problems. It can cause you pale skin, and many more. And Roxanal is a highly concentrated solution of the narcotic analgesic morphine sulfate for oral administration used for the treatment for severe and chronic pains. And these are just some side effects that you can get from Roxanal. For the Roxanal consumers, there's many warnings. You should keep the medicine in a safe place to prevent theft, misuse, or abuse. If a child accidentally swallows this drug, you should go to the emergency room. A warning. Morphine has a high risk for abuse and severe, possibly fatal breathing problems. The risk of harm is higher if you take the wrong dose, strength, or if you take along with other drugs that might also affect breathing. Be sure you know how to take morphine and what other drugs you should avoid taking with it. The risk of breathing problems might also be higher when you start this medication. After a dose increase, get immediate help if you notice unusual slow, shallow breathing. You should always take this medication by mouth and without food as directed by your doctor. If you have nausea, it may help to take this drug with food. Consult your doctor or pharmacist about other ways to decrease nausea. The next page is clinical and patient information pharmacology. Some major effects of morphine are on the central nervous system and the bowel. Opioids act as agonists, interacting with stereospecific and central binding sites or receptors in the brain and other tissues. Morphine may impair the mental and/or physical abilities required for the performance potentially hazardous tasks such as driving a car or operating a machinery. The patient should be cautioned accordingly. Morphine, like other narcotics, may produce orthostatic hypotension in ambulatory patients. Some warnings. Morphine can cause tolerance, psychological and physical dependence. Withdrawal will occur on abrupt discontinuation or administration of narco-antagonists. And there's many more. Next page is the treatment. The primary attention should be given to the reestablishment of adequate respiratory change through provision of a patient airway and the institution of assisted or controlled ventilation. The narcotic antagonist naloxone is a specific antidote against respiratory repression which may result from overdose or unusual sensitivity to narcotics, including morphine. Therefore, an appropriate dose of naloxone should be administered, preferably by the intravenous route and the simultaneously with efforts and respiratory. Next page is overdose. So what would happen if you were overdosed? The serious overdose with morphine is characterized by respiratory depression, a decrease in respiratory rate and or tidal volume, extreme progressing to stupor or coma, skeletal muscle flaccidity, cold or clammy skin, and sometimes bradycardia and hypotension. In severe overdose, apnea, circulatory collapse, or cardiac arrest, death may occur. So you can actually die from overdosing from Roxanal. And the next page is pretty much what the Roxanal contains. So it contains morphine sulfate, 20 grams, milliliters of Roxanal, chemically morphine sulfate, and methyl. And this is pretty much the formula that is for the Roxanal, as you can see. So next page is just the works cited, and that is what my book is about, Roxanal.